When we talk about hearing loss in the clinic, I often say there is no medication, there's no surgery for this type of hearing impairment. The treatment is amplification through hearing technology. But as time progresses, more and more research is being done on ways to reverse sensory hearing loss. There's a company called Therapeutics. It's a publicly traded part of a larger conglomerate company, and they are starting to do lots of research looking at folks with a sudden hearing loss or a noise-induced hearing loss, but also just typical garden variety acquired hearing loss. The first molecular gene therapy I want to talk about is what's called Fx322. And this is meant for somebody with a noise-induced hearing loss. Think of the military folks. Think of our veterans or police officers or firefighters who are exposed to noise on a daily basis. So this first molecular therapy is meant for that population. And what they're doing is that they obviously have to start in different phases, doing animals first. Various rat, mice, chinchilla. The chinchilla has a very similar hearing mechanism to what we do as humans. And there's an injection through the tympanic membrane or eardrum with two different molecule drugs. And the idea is that they're going to diffuse on the cochlea and hopefully start to regenerate these nerve endings or hair cells. All of this research is based on there are some mammals that their nerve endings or hair cells spontaneously regenerate. Clinically, in humans, a few times a month, we'll have somebody call our office and they will say, I woke up with hearing loss. We test them and sure enough we find that just overnight they developed cochlear or sensory hearing loss. So we treat this as a medical emergency. They're going to see what's called an otologist and we be aggressive here. And so the idea is that we will do an injection through the eardrum with a steroid, which is just a heavy-duty anti-inflammatory agent, with hopes of restoring their hearing function. So it's from that philosophy or research that the Fx322 is an injection through the eardrum with two separate drugs with the hope of regenerating the stereocilia, hair cells, and the close nerve endings. So what have we seen? We're into human studies at this point in time. They're looking at a single dose versus multiple doses, one per week. The strongest data is lying on one single dose. We are finding that there are statistically significant changes in word recognition. So the ability to understand speech is 10% higher after these individuals have this injection of Fx322. So statistically significant, yes, but we know because we do speech testing in the office on a day-to-day basis, there is a 15 to about 25% test-retest variability in word recognition testing. So even though in the clinical trials, for some people, 35% in fact, they're seeing a 10% improvement in word recognition, we know clinically that does not mean anything. So Fx322, it's going in the right direction, but does it work at this point? No.